On this episode, we will talk about headaches before and after surgery. We'll talk about if birth control pill prevents you from having weight loss after weight loss surgery. And we'll talk about fiber supplements after surgery. Hello everyone, I'm Dr. Alvarez with Endobariatric.com and welcome to episode 208 of the AskDrA show. Thanks so much for joining us. And if you're interested in weight loss surgery, gastric sleeve content, weight loss in general, be sure to hit that subscribe button below. That way you won't miss any of our future episodes down the road. And if you like our content, if you are new to this platform on what we do here, let me explain a little bit of how this works. You can submit your questions to us. I'll be here to answer them for you. More than happy to do so. And there's one way to do this. You can send me your questions using the hashtag AskDrA throughout social media. That way we're able to grab those questions, add them to the list. I'll be here to answer them for you. All right, so let's go into this week's questions. They're really good questions, and they're also very frequent questions. Okay, so the original question is, how about headaches? What happens if I get headaches before surgery? Well, nothing happens. Nothing happens. I mean, you can take regular pain medication or whatever you are used to taking for a headache. You can take it safely. It's before surgery. I wanted to add the after, all right, because this is very common and this wasn't included in the original question. What happens to headaches after surgery? So let me start by saying that if you suffer of migraines and you have a hard time with migraines, there is a vast majority of the patients that those migraines go away after weight loss surgery. Specifically close to 60%. So 6 out of 10 patients, those migraines will disappear down the road once the patient starts losing weight. How does this happen? We really don't know. We know it happens. We know it may be related to the patient losing weight, the patient having less inflammation in the body, and maybe that has a lot to do with those migraines disappearing. Now here, I will take the time to explain a little bit about something we see very common, which is a headache after surgery. I mean, I'm talking about right after surgery, 24 hours after surgery, and this is very common. And we normally see this headache happen normally because of two things. Either the patient is lacking carbs, you are addicted to carbs, and all of a sudden you have surgery and then you have nothing by mouth and you get a headache. It's like whenever you don't eat and you get a headache. You've been fasting for so long, you get a headache and you're not used to this and you get a headache. And it's a very stubborn headache. Or you are really hooked on caffeine and you drink a lot of coffee and you're missing out on that caffeine right after surgery, and it is a very stubborn headache as well. So we normally give you something while you're here. I've got a headache, post-op, 12 hours, 24 hours. It's just a stubborn headache. Patients don't complain about the surgery itself. I mean, they don't complain about any abdominal discomfort. It's just I got this headache. We give patients some pain medication to do the IV, minimizes the headache, but until they get back to the carbs or back to the caffeine, it goes away. So I wanted to address this is because if you're planning to have surgery, to get gastric sleeve surgery or any type of surgery, hey, ease off on the caffeine, ease off on the carbs to get you in preparation for your surgery and not have this stubborn headache after your surgery, okay? Now, let's talk about a regular headache down the road. You didn't have a headache first few hours after surgery. You're back home. You're 5 days, 7 days, 10 days post-op. You get this headache. What can you take? Well, number one, touch base with your surgeon. My patients have my direct email, so you can always email me directly. But touch base with your surgeon. I mean, we normally advise that the best medication for pain, including a headache, is always Tylenol after any type of weight loss surgery, including gastric bypass, lap band, or gastric sleeve. All right, so Tylenol will be the least aggressive medication on your stomach, and that's why we always go that way. But wait a minute, Dr. A, just Tylenol just simply doesn't work for me. Touch base with your surgeon, all right? So it doesn't mean you can't take other types of medications, but just run it through your surgeon just to make sure it is safe to take. All right, second question is a very common question. That's why we included it on this week's show is, does taking birth control affect weight loss after weight loss surgery? And the answer is no, all right? So there has been a lot of studies out there that are comparing or just analyzing if the pill produces weight gain or weight loss, or the patch weight gain, weight loss, or or the ring. No. And if you're thinking of having weight loss surgery, or you had weight loss surgery and you are on this type of birth control, it will not interfere with your weight loss, because the weight loss procedure is way more powerful. It is a very powerful tool that will bring you down on the weight, no matter if you are, if you have the patch, or you're on the birth control pill, or you're using the ring. So if you still have any questions, be sure to touch base with your OBGYN on what type of birth control you are using and what to use after surgery. We normally manage the same birth control. We don't change the patients up on any type of method. We suspend any type of medication that day of surgery. So if you're taking the pill, you would miss the pill that day. That's it. You would start the following day, and you go on with your own life and the birth control altogether. And guess what? You have the weight loss. All right, so it will not interfere with weight loss at all. And the third question for today's show is, can I take fiber supplements after surgery? The answer is yes. The question would be, do you normally take fiber supplements before surgery? And if so, I would recommend you continue to do so after surgery. You can take them. It will not interfere. Run this by your doctor before you leave the hospital, or if you're already at home, run this by your doctor, specifically on your case. But the answer is it won't interfere at all. It is safe to take fiber supplements. I tell patients the first 3 to 4 months after surgery, be sure to don't stack medications in your sleeve. The sleeve has a very limited space. It's very, very small. It's pretty much a virtual space. So spread medications apart, including some fiber supplements. All right, so if you're taking fiber gummies, spread them apart. Take your medication, wait 30, 45 minutes, take the next medication. That's a good way to do this. Hey, listen, if you are taking fiber supplements because of constipation, be sure you're getting enough fluids throughout the day. And if you're still having some constipation, we've done a video that talks about tips on constipation. We'll link it below. So that way you have extra tips there and not just the ones I'm giving you on today's video. All right, so there you have it. That is it for episode 208. Hey, was this information useful to you? If you can leave me one of these, I'd greatly appreciate it. It helps a lot support our channel here, and don't forget to subscribe. Again, hey, send me your questions using the hashtag AskDrA. I'll be here for you. I'm Dr. Alvarez with Endobariatric.com, where we are changing lives one sleeve at a time. Take care and God bless.